What's great is it really helps that experience in the front line. I talk with a lot of systems and they say, I want to improve my omni-channel experience. I want to give the patient one place to go, but then it be able to allow me to drive messaging through text, messaging through email, messaging through web server, right? Customers like to access their health providers in a couple of different ways. So where automation is being used is helping to centralize those experiences for the patient. They might not know that they're using it because they have a front end display. It could be a web page, right? It could be an app on your phone. But on the health provider side, it's robots doing that interoperability play, syncing those systems together, creating that unilateral experience so that we can provide care real time. There's actually a really good story that we have a health system out of Dublin, Ireland. They actually use automation with a patient access system, SwiftQueue, across the whole country to do patient access. The customer or the patient in this scenario, they just use this really cool front end web face that gives them time to schedule appointments, kind of like Epic has MyCharts. The thing that they don't see is it's UiPath on the back end, negotiating all these different products and systems to collaborate and coordinate that care. This way, health systems don't have to make massive investments in new technology. It's fully composable from day one at a very low cost, at a very fast run rate, which right now I think everyone needs on this. Again, when you look at process optimization, everyone wants to run to where the productivity gains are. It makes sense, right? I want to shave off time. I want to save people time. We are very focused on finding that holy balance of patient experience and physician balance. I'm actually working with a very large hospital system who is doing pre-check-ins for gaps in care, where they have, I would say hundreds, it's probably almost hundreds of clinicians every night doing pre-check-in for gaps, for pre-visits that the physician is going to conduct the next day with the patient. Have you ever been sitting in a room with a provider and they're clicking on the computer as they're asking you questions? They're closing the gaps in your care for a number of reasons. It could be for ACO requirements, could be supersets for the state, depends on your insurance and what care management you're going through. So they're automating that process. That way, every night that checklist is done and the physician just gets the outcome, which is what's left open. What do I need to talk to Jason about to make this a proactive visit? Those sort of things of saving that time and providing just the insights that the physician needs to take care of a patient like you and I is really where that experience comes to play. And of course, there's other opportunities in the ICU, in radiology, where these charge nurses and ICU attendants are spending a lot of time on the computer to order you a test, to get that IoT device on your finger registered within an organization like Philips. It might take 3 or 4 minutes, but that's them in the room with you staring at a computer and not engaging you as a patient. So we want to take their fingers off that keyboard and have them spend more time with the patient to get you in, cared for, and then of course discharged. Adoption is the hardest part. I always like to say that technology is the easy part, adoption is the hard part. It's not like a technology like an ETL, which a lot of people understand that from a data perspective. It's not a conversion suite. It's not middleware. There's a lot of products you can try to drop into the IT business, and it's just there, and you don't realize it's a tool you can leverage. This is a process optimization product. It's literally changing the way a business does work. I mean, I have hospital systems across the world that have actually named their bots and used the bots as a part of their business. They're like, hey, I need to do credit adjustments. Just give it to Dave. Dave's a robot, right? So driving that adoption is really important. So when I talk to health organizations that are thinking, hey, I need to bring in automation to really optimize my business. First, I say you need to have a vision. I would never recommend you drop in a tool just because you think you need it. There has to be a strategy. There has to be a transformational element behind it. I want to approach this. Reducing cost is great. Everyone wants to do that. But I want to be able to improve experience in radiology. I want to be able to transform my case management system so I can proactively reach out to patients. These are big, heavy rocks that CIO, CTO, and CFO leaders are driving. They need to come with that vision and then realize, how does automation fit into that play? That'll give them a roadmap. The next piece is really engage with someone that really knows how to do this. There's now hundreds of healthcare systems that are going through this process. We have hundreds that have a level of maturity that they can actually share. Listen to their stories. They're going to give evidence, recommendations. We will too, but my job is to connect the two together so you're talking. So listen to what they're saying. They're going to give some great advice and give you a great roadmap. And the third piece, and this is the hard piece, if you don't feel that you're culturally ready to staff and build a center of excellence to deliver this improvement, leverage a partner, leverage a consulting organization. We have over 900 consulting organizations that we work with that are delivering automation into healthcare environments, all the way from small acute care to large IDNs to public health agencies. They have the bandwidth, they can absorb the risk, and they can even go at risk for some of your biggest transformation programs. And what's more important, they know our product. So they can come in, they can deliver it, teach you how to fish, which is what they want to do. They take on the more complex stuff, and then you're driving a really well-oiled center of excellence inside your business that can then take on this technology and make improvements across the enterprise.